Okay, we're going to talk about the pelvic bone and the pelvis. So let's take a look at this picture and we're going to try to remember where the major parts are. So the three major parts are first the ilium. Where's the ilium? The ilium is here. Where is the pubis? This is the pubis. And where is the ischium? There is the ischium. Okay, let's move on. Okay, we're just preparing another slide here. I thought it'd be fun just to share this with you, because I love the song. Arthur. Dudley Moore. Okay, we're looking at the pelvis here, and we're going to try to name some of the structures. So first, let's try to find the ilium. Where is the ilium area? This is the ilium area, and we're looking at the ala and the body. The ala means the wing, so this is the wing, and here is the body. Okay, now let's look for the acetabulum. Here is the acetabulum. Where is the ischium? This is the ischium. Okay, how about the pterygiate cartilage? The pterygiate cartilage is right here. Okay, this is a little more detailed. Let's try to find the iliac fossa. Wow, that's an easy one. How about the ischial tuberosity? Where's that? This is the ischial tuberosity. And then the ischial ramus and the ischiopubic ramus. Alright, where is the pubic crest? That's right here, the pubic crest. Okay, let's try one that's a little more difficult. Where is the arcuate line? That's right here. Okay, where is the superior ramus of the pubis? That's right here. Okay, so these are some of the structures. Again, here is the ala of the ilium, and this is a very important part right here. This is the anterior superior iliac spine, which is very useful when you are trying to figure out pain coming from appendicitis. You make a line with the umbilicus, if you remember, and you can figure out where the appendicitis is, where the pain is coming from. Okay, so basically, just to describe this is right and left hip bones, two large irregularly shaped bones, each of which forms at puberty by fusion of three bones: the ischium, the ilium, and the pubis. Okay, we're looking at the male pelvis and the female pelvis. So just take a look and see if you can notice any differences. Okay, first let's look at the male pelvis. So the male pelvis first is thicker and heavier, and the greater pelvis is deep. The lesser pelvis is narrow and deep, and the pelvis inlet is heart-shaped. You can see that. And the pelvis outlet is small, and the pubic arch is narrow. So let's look at the pubic arch. Compare the pubic arch in the male to the pubic arch in the female. So in the female pelvis, it is thin and light, and the greater pelvis is shallow. The lesser pelvis is wide and shallow, and the pelvic inlet is oval or rounder, and that of course is for childbearing. And the pelvic outlet is large, and the pubic arch is wide, as we have just said. Okay, we're looking at joints of the pelvis. So we're going to look at joints of the pelvis in detail. So first let's take a look at the picture and see if you can figure out what's going on here. Okay, let's take a look at the anatomy here. What we're looking at here is the junction between the sacrum and the hip bone. So these junctions, these are connections here. So first let's look at the top here. We can see the sacroiliac joint, which covers the joints. And we can notice that this is the anterior sacroiliac ligament. And right here we're looking at the this is the interosseous sacroiliac ligament, and this is the posterior sacroiliac ligament, which overlies the interosseous ligament. So this comes over this. Alright, so what is this? This is the pubic symphysis. So let's take a look at this and think about what we should learn from this. First, we should remember that they are bounded by the sacroiliac ligament, and also that there is as for the sacroiliac ligament, there is an anterior and a posterior segment. So let's see if we can recognize these and remember them. So what is this? This is the anterior sacroiliac ligament. What is this? The pubic symphysis. This is the sacroiliac joint. And here we have the interosseous sacroiliac ligament. And this is the posterior sacroiliac ligament, which overlies the interosseous ligament. Okay, we're looking at the pubic symphysis joint. And we're going to try and pick out a few features here. Okay, so the main point here is we're trying to find the superior pubic ligament and the inferior pubic ligament. So first let's try to find the pubic symphysis, and that is right here. So where is the superior pubic ligament? That's right here. And the inferior pubic ligament is right here. Where is the ischial ramus? That's right here. Where is the obturator foramen? That's right here. Where is the pectineal line? That runs up here. This is the pectineal line. And where is the pubic crest? This is the pubic crest. Where is the pubic tubercle? This is the pubic tubercle. So one more, where is the inferior pubic ramus? This is right here. So remember from this slide, the superior pubic ligament, which is right here, and the inferior pubic ligament. This we're supposed to get from this slide. Okay, this time we're looking at the lumbosacral joints and the sacrococcygeal joint. So just take a look at this for a second. Okay, so we will be looking for the lumbosacral ligament, the iliolumbar ligament, the anterior longitudinal ligament, and some other points. So first let's look for the bigger points. Let's look at the ilium. Where's the ilium? Point that out. Okay, this is the ilium. Where is the anterior sacroiliac ligament that we looked at on the other slide? That is right here. And where is the intervertebral disc? Of course, that's right here. And what is this ligament then? This is the anterior longitudinal ligament. This goes all the way up. Where is the lumbosacral ligament? That's right here, the lumbosacral ligament. And where is the iliolumbar ligament? That's right here, the iliolumbar ligament. Okay, so we looked at the anterior longitudinal ligament, the lumbosacral ligament, and the iliolumbar ligament. Okay, next we're going to be looking at some clinical correlates. So first take a look at these pictures and see if you can figure out what's going wrong. Okay, the point here finally is just to notice some weak areas that often break. The first one would be the fracture of the acetabulum. And this is a central fracture of the acetabulum with a disassociation of the femoral head into the pelvis. That looks very painful. And next one is much more serious. This is a fracture of all pubic rami, a straddle injury. This double break happens in continuity of the anterior pelvic ring, which causes instability but usually little displacement. Visceral, especially genitourinary injury likely. Wow, I don't know which one is worse here. So this is a fracture of the acetabulum, and this is a fracture, this is the straddle injury. So good to know these clinical correlates, and remember that the weak areas are the pubic rami, the acetabula, the sacroiliac joint, and the ala of the ilium.